Max, are you sure you have cancer? Are you sure?
No.
And Katie, you're just here for emotional support?
Emotional support and to see Dr. Cuter
Oh, that's right.
for her annual checkup.
And Kara, what's happening in 5 days?
I'm getting married.
Ah, don't worry, it's only the first one. If it doesn't work out, you can do it again and again and again.
Exactly.
Don't tell Dr. Cuter that. You're so cute. Did you get a haircut? Did you get a mani-pedi? I did. No.
Please
See?
don't let anybody touch his nails.
Aw. Let's look at the lymph nodes. Good boy, Max.
All right, little jumping bean.
What happened today? Good boy. All right, Michelle, how's Mr. Snoopy doing?
Snoopy's doing very well in regards to his activity and appetite. We did lose a little bit of weight though.
That's okay. He gained like 2 pounds the first
Yeah.
week. How much did you lose?
We went from 14 kilograms to 13 kilograms.
That's okay. He started at 12.9 kilograms. So, and I kind of got them a little bit concerned about letting him eat too much because he's already
A little bit.
on the round side, shall we say. So Snoopy has B-cell lymphoma. That's the better one. He's a little sassy, just like me. So he gets a little muzzle. And he's on week 3. So he's getting vincristine today, as long as your blood work is good. You've had this drug before and you tolerated it very well. His lymph nodes were ginormous when we started. That's my medical term.
I like that medical term.
Yeah.
Ginormous.
And now they're normal. Oh, Snoopy, good boy.
It's okay, Papa.
You're almost done. Your lymph nodes feel good. You're responding.
You can say,
Buster, your butt tumor looks great. Why you make a mast cell tumor back there? Huh? All right, we'll get some blood, give you chemo number 2. Tolerated the first one great, so no Serenia, no nothing.
good job, buddy.
Right? They didn't
Right,
use
yeah.
any? Great.
You see one?
Come on, get your ears up. All right, so let's show everybody where your tumor was. Show us your butt. It was in this area, just below the bum, below his anus, right there in that area. We can't even measure it anymore. Good job. Yay. All right, let's get some blood.
This is for CBC. I'm pulling like a full
Just a
can.
CBC.
Okay. Save the rest.
Oh, Buster.
Perfect.
Today was kind of interesting because both of my new consults, so patients that I haven't seen before, were for primary bone cancer, but they were a little bit different. So first we saw Chester, who is an 8-year-old male neutered, long day, it's the end of my day, mixed breed dog who has about a 2-month history of lameness. And when he got x-rays from his veterinarian, so it was at the stifle, the top of the tibia bone, which is right below the knee. So that's another word for stifle. And so he got some x-rays and there was definitely some bone lysis, but it wasn't classic for osteosarcoma, which is the most common primary bone cancer that we see in dog. And the reason it's not classic, it was actually invading into the joint as we showed in the x-rays. And that is not classic for osteosarcoma. So I'm more concerned that his primary bone cancer is maybe something like synovial sarcoma, which is a cancer of the joint capsule. He was the one that had a bone biopsy that was non-diagnostic. And that's a common thing that we see with bone cancer is that it's non-diagnostic and you just get reactive or inflammation, and that can be really frustrating because you take the time and the energy and the money to do a bone biopsy and not get an answer. So for him, we did some x-rays today because there were some questionable nodules on his first set of x-rays about a month ago, so we're waiting to see what our radiologist thinks about that. And we did some blood work, and then we gave him zolidronate, which is a bisphosphonate. So it's an injectable medication given once a week that can really help with bone pain. That can be used for primary bone cancers or cancer that is metastasized and spread to bone. So that's what we did with him, and then the owners are going to decide whether they want to do radiation or amputation. You know, most owners really don't want to do amputation. When you tell them that, you know, that the treatment is to remove a leg off their dog, they think we're crazy. But about 85% of owners will be satisfied with that when they do it. Good night, Ashley. Ashley's out of here. Say bye. Drive safely.
Okay.
I'll see you in the morning. Bye, Ash. So that's one of my nurses. She's rocking it. Ashley, how long have you been with me?
Since August.
And is it as bad as you thought it would be?
No, it's amazing, and I love you.
Oh, I love you too. See, she likes surgery, and now she's learning to like oncology too. You're the best.
Thank you.
Drive safely. Okay, so that's Chester. We gave him some Zolidronate. We're waiting for his chest x-rays, and then the family is going to decide about amputation. They were pretty against it, but they're thinking about it, which is a success for me as long as they're thinking about it. And I gave them two great resources. So one is tripods.com, TRIPAWDS.com. It is a great resource. It's a great community of three-legged dogs, predominantly, and cats as well, and pet owners who have gone through that. And the other one I tell people is to Google three-legged dogs on YouTube, and you see some great videos and see how well these dogs can do. I think it is way harder for the pet owner than the dog to recover from amputation. So most dogs can still do lots of normal things: swim, run, sit on the couch, go for walks. They really can do great. So that is a big challenge. Okay, so what was the second bone cancer that we saw? So this is Bella. She's an 11-and-a-half-year-old female spayed greyhound. She was a racing greyhound. Owner said she only ran a couple of races, and they adopted her, I think, 9 years ago. So they've had her for a while. But greyhounds are definitely one of the breeds that we see osteosarcoma. She has it in her proximal humerus up by the shoulder, and really classic radiographs that I'm going to show you right now. So you can see she had some changes, lytic lesions. So there's a combination of bone lysis and bone production. And this is very painful for dogs and also puts them at risk for fracture. This family did amputate one of their other dogs a couple of years ago. And actually that dog did really well, but they're really concerned about Bella. They're concerned because it's a front leg. Dogs do put a little bit more weight on their front legs, but still in my experience can do super fantastic with an amputation. And mom and dad are really not thinking that they're gonna do an amputation for her. So, oh, Bella, you're so cute. So she's going to come back for palliative radiation. So that is the plan for Miss Bella. She's super fantastic, and who does not love a greyhound? We also gave her Zolidronate, that injectable pain medication, which lasts 4 weeks, and we started her on her chemo. So the plan for her is to combine palliative radiation, which is really good at helping alleviating the bone pain, the pain from the tumor itself, and that'll be focused on the shoulder joint, or the bone by the shoulder, and then we can combine that with chemotherapy and the Zolidronate, and the chemo will hopefully delay metastasis. So she did have normal chest x-rays with her vet just about a week ago, which is great. But the problem with osteosarcoma, again, primary bone cancer, 85% of dogs with primary bone cancer have osteo, is not only is it painful and destroying the bone in the primary site, has a really high metastasis rate. So even if we think the chest x-rays are normal, we know 90% of dogs have microspread, micrometastasis in their lungs. So again, for this family, amputation is not the right choice. We did spend a lot of time talking about it because, again, a lot of people that come to see me that say they won't amputate do and are really happy. They just need to kind of work through it and really understand how well dogs can do with an amputation. But I'm not going to force anyone to do anything. So again, for this family, the right choice is hopefully going to be palliative radiation combined with the Zolidronate for pain and the chemotherapy. So today she got her first dose of chemo and her Zolidronate. She'll be back in about a week and a half. We'll check her white blood cell count at that appointment, and she'll see Dr. Ware, and her next chemo will be in 3 weeks. Her next Zolidronate will be in 4 weeks. So we love you, Bella. Good girl. See you back in a couple of weeks, okay? Get you in to see Dr. Ware soon. Who's a good girl? You good girl? It was interesting today to have both bone cancer cases, but a little bit different. So hopefully both will kick cancer's butt and do super fantastic.